But Smith says her daughter, who saw a different doctor, described a very different experience about the way he took her pulse.
I said, what? And she said, she showed me, she said here. And I said, under your shorts or on top of your shorts? Not that it made a difference because he shouldn't be touching it there anyhow. And she said, underneath my shorts.
So if you haven't heard it, this is a viral story going on about a teenage girl who had an experience with a school district physician during a physical where she felt she was inappropriately palpated during an exam. Where that palpation took place was actually where the femoral artery runs. So the femoral artery runs in an area where the hip meets the abdomen. And it's actually an area where we can check the pulses that are actually quite strong. It's an important part of the newborn exam. And the reason why it's so important is because you can actually have a change in the size of the aorta. It's an artery, a very large artery that pumps blood away from the heart. And you should feel these strong pulses with each heartbeat. But if there's a change in the pressure, the pulse can actually feel very different in the lower arteries, like the femoral artery versus upper. So as I mentioned, this is a really important part of the cardiovascular newborn exam, just to screen for something that we call the coarctation of aorta when it comes to newborns. But when it comes to teenagers, it's also helpful to screen as part of the cardiovascular and pulses exam. Equally important is to discuss and disclose what you are doing at the time, especially I think naturally as a pediatrician, we do this a lot. I know I do it when I'm checking newborn hips because it can look a little barbaric what we're doing. It's very helpful to vocalize and say what you're doing and what you're trying to find out and what you're screening for. Now, obviously, I was not in the room for this exam in this particular case, and it's really hard to know what happened and what didn't happen. What it is clear is that there was no chaperone, and in this case, if the child was uncomfortable, if the teen was uncomfortable, there should definitely have been an opportunity for a chaperone.